This is Jim Garreffi. I'm the health agent for the Littleton Board of Health and the director of the Neshoba Associated Boards of Health. The town of Littleton is a member of the Neshoba Associated Boards of Health, and I'm the health agent for the Littleton Board of Health. It is our job to help the Littleton Board of Health do their duties as a Board of Health. I'm here to talk to you a little bit about COVID-19 today, so I'd like to start about where we should get our information. There's lots and lots of information out there that you may see regarding COVID-19, but it would be our recommendation that you look at those sites that are state and federal that provide regular and updated information, such as the Massachusetts Department of Public Health and the Centers for Disease Control. Those sites have a wealth of information, and the Massachusetts Department of Public Health will keep you up to date on the actions that are occurring here in Massachusetts. As a health agent in town, I'm available to take questions by phone call. The phone number at the office is 978-772-3335, and my extension is 305. Our senior food inspector from the Neshoba Associated Boards of Health has reinforced with all the food establishments the governor's orders on gatherings and on-premises food consumption. Our health agents will be monitoring those establishments to make sure they are complying with those rules. The Neshoba public health nurses are conducting their regular disease surveillance and reporting duties for the Board of Health, and I'll discuss a little bit more about those duties when it comes to COVID-19 a little later. I'd like to start with a brief description of how the disease is spread. CDC describes the disease as being spread mainly by person-to-person transmission. Being close to a person within 6 feet, coming in contact with the respiratory droplets from someone who's infected through a sneeze or a cough. There are things you can do to protect yourself and your family. Hand washing for at least 20 seconds, making sure that you get your fingertips with soap and water. Avoid touching your face, your nose, and your eyes. These are points where the virus can enter your body. Particularly after coughing or sneezing, make sure you wash your hands. Avoid close contacts with others. And if you're sick, you can take the following actions to minimize your risk of infecting others. Separate yourself from others. Wash your hands as described for at least 20 seconds, particularly after sneezing. Avoid sharing personal household items, such as eating utensils, towels, and bedding. Clean and disinfect all high-touch surfaces on a regular basis. Here are some things you can do to protect others. Stay at home if you're sick, except to get medical care. And if you are suffering COVID-like symptoms or flu-like symptoms, please call ahead to your primary care physician, or if it's an emergency situation, to the EMS folks to let them know you have these symptoms. Cough and sneeze into a tissue. Wash your hands afterwards. Disinfect frequently touched surfaces. Social distancing is a term you're hearing a lot of, and it's really important if we're going to try to reduce the transmission and the spread of this disease. The Department of Public Health has guidance called Stay at Home and Stay Safe, and it describes the following things that we can do. If you're 65 to 70 and or have medical conditions that may make you more predisposed to COVID-19, please stay at home except to go out for essential services such as going to the supermarket, going to a pharmacy, and going outside to get some fresh air. For all of us, stay at home means the following. Only leave your house to do essential tasks like getting groceries, going to the pharmacy, maybe getting some fresh air. And if you do so, try to avoid unnecessary contact with others. Should you still need to run some essential errands, it's okay to do so. Going to the gas station, sending packages, receiving packages. If you need to fill prescriptions, see if you can get those prescriptions filled for 90 days. And if you need to stay at home, see if it's possible to get them by mail order. If you need to go to the gas station, that's acceptable. If you need to go out and get some fresh air, we would encourage that. But again, try to remember that social distancing component. Use remote forms of communications to stay in touch with friends and family, such as the phone or video devices. All non-essential medical and dental appointments should be canceled and rescheduled for some time after this COVID outbreak. If it's possible, try to do your healthcare visits remotely. Parents shouldn't arrange play dates for the children at this point. Again, we're trying to slow that transmission of the disease and practice social distancing. And all individuals should eliminate activities that have them coming into close contact with one another. I want to discuss a little bit about what happens when the Board of Health receives a lab-confirmed case of COVID-19 in your community. And in doing that, I'd like to describe some terms that are important for you to understand what we do. The first one is close contacts. That means having contact with another person within 6 feet for more than 15 minutes. Isolation. Isolation means the separation of a person or a group of persons known or reasonably believed to be infected with a communicable disease or potentially infectious, and from those who are not infected to prevent the spread of disease. Quarantine generally means the separation of persons or groups of people reasonably believed to have been exposed to a communicable disease, but are not yet symptomatic. We do this also to try to slow the spread of disease. The Department of Public Health operates a communicable disease surveillance system, and our public health nurses are tied into that system to be able to protect the citizens of Littleton. When we received a lab-reported case through the surveillance system, our public health nurse will do the following things. They will contact that person who is positive and describe to them the isolation requirements under the Massachusetts regulations. At the same time, they will answer any questions the person may have about isolation, and they will inquire about close contacts that person may have had with other people. Once they have that information, they will provide the person with a phone number to follow up, and they will contact those close individuals to explain to them the requirements the state has for quarantine. People who are close contacts with a person who is tested positive COVID will need to quarantine for a minimum of 14 days. And our public health nurse will explain what is meant by quarantine and send them information regarding their quarantine period. The Board of Health may find out in other ways that people are affected with COVID-19 in the community. This may involve you receiving a medical diagnosis from your doctor. In those situations, when we hear about those cases, our public health nurse will follow up on those individuals in the same way that we do when we receive a lab-confirmed case. The Board of Health is pressed for information regarding the names and locations of people who have tested positive in the community. And we cannot give out that information because it's considered protected medical information. The Health Insurance, Portability, and Accountability Act, known as HIPAA, has a privacy rule that prevents us from providing individually identifiable health information for people in town. To summarize, the Board of Health is taking the following actions to make sure the citizens of Littleton are protected. We're providing links for the public for information that will be useful for them going forward. We're conducting inspections and responding to complaints with regards to the governor's orders for gatherings and on-site consumption of food. Our public health nurses are conducting their regular disease surveillance and monitoring, particularly with those cases of COVID-19. The board wants to remind everyone to do the following. Wash your hands for at least 20 seconds with soapy water. Stay at home if you're sick. Sneeze or cough into a tissue. Wash your hands afterwards. If you need medical attention, please contact your PCP, and if you're suffering flu-like symptoms or symptoms associated with COVID, please let them know that ahead of time. If you're calling for an ambulance, please let the EMS crew know that also. The Board of Health will be working closely with the Emergency Medical Director and other town officials to keep citizens informed and help you address any questions you may have. Again, my phone number at the office is 978-772-3335, and my extension is 305. Thank you.